TPN. I keep saying that word. Did you know what it stood for? Total parenteral nutrition. Okay, make sure you understand the word parenteral. What does parenteral mean? IV. So this is going directly into your veins. So here's the deal. A lot of times when people go into a hospital, they are going to have surgeries, they have medical conditions, there's something bad going on with them, and they need to go in there and work on that. Okay? While they're working on that problem, the person needs to heal, they can't eat. Again, if there's a bowel resection, if they have to go in through, because whether it's cancer or severe inflammatory disease, they have to remove part of the small intestine or large intestine, they have to go in there and surgically go in there and open up the intestine, cut out a part of it and re-sew it together. What would be a terrible thing to try to do as the person's trying to heal? Send food through the GI tract, and that's just one kind of example. So what we're talking about with the TPN is giving everything that person needs to survive from a nutritional aspect through an IV line. So NPO, nothing by mouth, okay? So that we're going to feed them entirely, which is why I always like this little picture here after Thanksgiving. Essentially, you're getting your Thanksgiving dinner, which includes something to drink and something to eat, everything in this IV bag, because you're not going to consume anything orally to go through the GI tract for some reason, all right? So because of that, we make essentially a bag that has all of what the person needs, both fluids and calories and protein. We'll talk about the components here in a minute, everything they need in this one big bag, okay? Fortunately, the time that and you do these quite a bit in a hospital. I know a lot of you work in the hospitals now. Again, not every, in the smaller the hospital, sometimes they won't make them themselves, but the KU Medical Centers, any larger metro hospital will make TPNs. Fortunately, patients only usually need them for short term, usually 7 days or less, the amount of time they need to recover from the surgery or whatever the reason was. Until they recover, they'll need it for maybe 3 days, 5 days, 7 days, but could you starve to death and if you didn't have any fluid in a couple of days? Yeah, so we don't want them to die while they're recovering. We're going to put them on a TPN to keep them hydrated and fed until they can start consuming stuff again through their normal way. All right? There are some times, though, people can be on TPNs longer term, but they're less common. That's kind of a rationale. So all I'm trying to get at, what are we going to put in the TPN? Why are TPNs the most difficult calculations and products to prepare in a hospital? Because they have so many ingredients, all right? And that's why they're confusing for you guys to learn. But I want you to break it down here. If you think about what you need to consume in a daily amount, what do you consume from a nutritional standpoint? I see a lot of people with water bottles. Why do you have water bottles? Fluid. You need to keep hydrated, right? So part of what's in the TPN is a volume of fluid to make sure that they get enough water. So we'll talk about water amounts. You need proteins, right? And then lastly, we'll talk about in terms of the rest of the rest of your energy needs are going to come from energy sources of carbohydrates and fats. And those are the main building blocks of the TPN. So I'll try to go through some of these slides quickly, but water, when we talk about a total TPN volume to provide the amount of fluid somebody needs in a day, it's really important. It's an important calculation, just like the reason why you got to stay hydrated. What happens if you don't drink enough? You can become dehydrated. Is that really a medical emergency if you become dehydrated? Yes. Why? Because you lose blood volume. And if you don't have enough volume of your blood pressure goes down, you can't perfuse your organs. You won't live long if your kidneys, heart, and brain don't have enough blood flowing through them. So we got to make sure there's enough fluid. We don't want to overestimate, because if you stick way too much fluid in the TPN, then the body gets overloaded. It can't move the blood very well. The fluid leaks out in bad places like your lungs. If you have fluid in the lungs, then you can't breathe. So again, getting the right amount of fluid is going to be really important in these calculations. Proteins are one of the more difficult, well, I won't say difficult, they're an important part of why people in hospitals get TPNs. Because why are they in the hospital? They're sick. They've had surgery. They've had some trauma. And proteins are primarily used in the TPN to replace what the body needs to regrow tissue. To build tissue, to repair tissue, you need proteins. You're going to see the amount of protein that we put in the TPN is directly dependent on how sick they are, how much trauma. And you know the people who need the most protein out of all? Burn patients, because burn patients have problems that need to be repaired in a large surface area versus maybe a small blood vessel. So again, the more damage physically, then the more protein you need to repair it. The only trick we'll have to account, though, proteins can be broken down for energy. Even though we don't really want them in the TPN for that reason, we want them for the ability to regrow tissue, they can be metabolized, and so we're going to account for the calories that come from the protein. But we want to make sure we provide them enough calories every day so that they don't use the protein. So the other source of calories that we're going to provide are carbohydrates, right? They're the tasty calories, if you will. So again, we're going to do that in the form of dextrose. So that is a sugar molecule that we prefer to be used as far as an IV fluid goes. So we're going to use dextrose as our main source of carbohydrate. We're not going to do all of the calories, though, from carbohydrates. There are some limits to how much carbohydrates you can consume in a day. And twofold. You might think it might be the blood sugar. Have you guys been told about your blood sugar? And again, what is the hormone that you guys secrete from your pancreas that helps regulate blood sugar? Insulin, right? That's the kind of the issue with diabetes, right? Don't have enough insulin to regulate blood glucose. Well, we don't want to overwhelm the body's ability to maintain blood glucose, but it turns out there's another organ that's very important in terms of regulating glucose, and it's your liver. Did you appreciate that? You don't appreciate your liver, because here's the deal. What if you skip dinner? What if you don't eat at all at night? Well, how come you don't die from no energy in the middle of the night? Okay? Your liver makes glucose, right? That's what glycogen is. Glycogen is a storage form of glucose, so there's gluconeogenesis, there's glycogen formation and removal. The liver has an important role of providing glucose when there is no glucose from dietary sources. So it turns out we're going to have to limit the amount of glucose that you give a person, and I should say dextrose. Dextrose is the form of glucose. We're going to limit our dextrose to what the liver can handle. If we swamp the liver, if we give too much that the liver can't handle it, then we get into serious problems. So that's just an important part. So what we can't get from our carbohydrates, we will make up the difference from fat. We'll use fat emulsion, and again, fat is kind of an important source. We don't want to overwhelm the body as well, but it serves as hormone, a basis of the formation of various hormones, and it provides a lot of calories. It's got more, 10 kcals per essentially gram of that. So it's the most efficient caloric source, but again, we want to minimize it and only make up the difference from what we can't give from the carbohydrates. So it's a balance between carbohydrates and fat to make up what's the remainder. All right? Those are the main building blocks. What I've said so far is we've said water, volume is important, protein is important to heal, and then carbohydrates and fats are your nutritional sources of energy. All right? On top of those, base solutions, and that'll be the volume. The majority of the volume of the TPN comes from those things we just talked about. But equally as important, although smaller in volume, are all of your electrolytes. Would you agree? Through sweat, pee, everything else, you lose sodium, you lose potassium and calcium and all these things over time. So we need to replace those. And I don't need to belabor the point that these electrolytes are important for a variety of nervous functions, obviously. The biggest issue when we do our calculations is just know this, we are going to have to replace those. So part of what you got to calculate is how much sodium to give a person and how much potassium. We're going to calculate those amounts. But when we mix those things together, there is a big problem with two of those. Calcium and phosphate tend to like to come together and form a precipitate, actually form a particulate, calcium phosphate. Why are particulates bad in IV fluids? They can clog up your vessels, right? So we don't want any particulates floating around in there. So we have to be really careful in the amounts of calcium and phosphate we give, and we'll do a little what we call a chalk test when we make our TPNs to make sure that we're not forming that calcium phosphate. That would be bad. All right. Beyond that, and that's really the main part, those base solutions for energies, volume, protein, then we have all of our electrolytes. And again, depending on how long somebody is going to be on a TPN, it might be a week, it could be 2 weeks, it could be a month, then we might need to add some additional things like vitamins and minerals. All right. So there's a nice thing about that. It's a simple injection. Multivitamin for injection has 10 to 12 vitamins in it. You can then add what they call trace elements, which are minerals versus vitamins. And then there are some other special things you can give over time. I won't belabor those points. But there's some other miscellaneous things you can add, then depending on how long the TPN is going to last. All right? So to think about that, though, that's a lot of stuff. And what is that? And again, when we talk about the pump method, it's all going in one bag. One bag is going to have dextrose and protein, and it's going to have fat, and it's going to have all those electrolytes and all of those vitamins and all those minerals. That's going to be a highly, hopefully you're comfortable with this term, osmotic solution. It's going to have a very high osmolarity, because osmolarity is based off of what? The number of particles in solution, and there's a ton of particles in this solution. There is no way you can just run it through a regular IV line, because again, where we said normal osmolarity is about 280 to 300, these can be in excess of 600 millimolars, okay? So milliosmoles per liter. So we can't do that. So where could we administer such a highly osmotic force to dilute it as quickly as possible? Where's the largest blood vessel in the body with the fastest blood rate going through it? Would you agree that would dilute it as quickly as possible? You want a large volume with rapid blood flow. And that's essentially the vena cava. So when we talk about TPNs, you don't administer them out here in the little vein in your arm. They may have a catheter that starts there, but that catheter winds all the way up and goes through and ends just above the heart, in the vein, in the superior vena cava, where it gets diluted and mixed as rapidly as possible so that those effects of that hyperosmotic forces are diluted. So again, those are called central lines. So the take-home message in terms of administration, they're highly osmotic, highly osmolar, so we got to use a central line. That central line puts the end of the catheter in the vena cava, and that can be a central line or what they call a PICC catheter. And this is something you got to know. If you're working in hospitals, you'll hear about PICC lines. PICC stands for peripherally inserted central catheter. So it's still going to end here, but a PICC line ends in the right place, but it goes all the way through, and again, you can kind of see where it sticks out in the middle of the arm here. So it's a much longer catheter, but still ends kind of at the superior vena cava there. I just wanted to go through on this slide to make sure you realize where there seems like there are a lot of calculations, but you can break them into two parts. There is essentially the macronutrients and the electrolytes for the most part, okay? Macronutrients, now just as a reminder, we talked about last time, the main components are going to be water and protein. And then carbohydrates. And the source of carbohydrates we talked about was dextrose as a form of glucose and fat. So dextrose and fats are going to be your carbohydrates, and then your protein, and then your water, essentially for the fluid part. Those are what we call macronutrients. And then we also talked about how you also are going to need a lot of electrolytes, your sodiums, potassiums, calciums, and all those things. So that'll be the second part. So you're going to see we're going to divide those calculations up into two parts. So let's do this with an example. So our example on the worksheet that you're going to fill out here in a second has to do with a 64-year-old man who weighs 95 kilograms and stands 5 feet 9 inches tall. He's admitted to the hospital for surgery. He's having bowel resection. So they're going to go in there. They have to open up his abdomen and actually going to have to, whether it's due to cancer or inflammatory bowel disease, something like that, they have to remove a section of his GI tract. Okay? They're going to sew it all back together. They're going to sew him back up, and then he's going to recover. All right? So what do you think he probably shouldn't do for several days, maybe a week? Eat or push anything through that bowel, and we don't want him to starve to death, so we're going to put him on a short-term TPN while he recovers from all of this, all right? So with that as enough of a background, let's go ahead and fill out the top line of your worksheet. So again, go to your worksheet. I won't flip back and forth every time. Let's see, go here and let's fill out that top line. So given that information on the slide, fill out his age. What did I say he was? He was, and you have your slides up hopefully as well, but he was 64 years old. I'll read them out so we can do it. He was a 64-year-old male. And on the height now, he was 5 feet 9 inches. So use your calculator kind of quickly because you're going to need his height totally in inches in a little bit. So let's calculate his height in inches. He's 5 feet 9 inches. So let's see if you can kind of come up with his height there. Okay, so we'll need his height in inches, and then we're going to need it in centimeters. So 5 foot 9, did you guys get 69 inches? So 69 inches tall, and then convert that to centimeters. Do you remember the conversion? It's when you eventually have to memorize. We did that with body surface area type things. 2.54 centimeters per inch. So if you take the total inches of 69 times 2.54, you should get a height of 175 centimeters. So just verify that. I don't want to just rush through this. Otherwise, you just watch me put the answers up. I didn't want to do that for the TPN section. Is everyone okay on the first line? So basically we said he was, I don't know how this will work or not, 69 inches, and I got 175 centimeters by multiplying 69 times 2.54. Okay? Easy breezy. Now this is important. His actual, so let's, the next line down, this is a big deal. The next line is a little more difficult. ABW stands for actual body weight. And I told you his actual body weight was 95 kilograms. So down here, under actual body weight, write 95 kilograms. All right? Next to that, I want you to go ahead and calculate his ideal body weight. I give you the formulas right there on the worksheet. They're the same as what you've done previously. Make sure you use the correct gender formula whenever you're doing an ideal body weight. Since this is a male, make sure you use the correct ideal body weight. And I'll give you a second, see if you can calculate his ideal body weight. These are the kinds of things that could be on the final exam. We did a lot of dosing with things, and ideal body weight was certainly one of the dosing things. So again, see if you can use that formula and come up with an ideal body weight. All right. I'll give you a second for some of you. I'm not trying to rush through this time. I got 71 kilograms for an ideal body weight. All right. Now, bear with me on this. What we now need to know is 120% of ideal. That is, I know his ideal is 71. What is 20% more than that? So just take 71 on your calculator and multiply it by 1.2. If you multiply 71 times 1.2, that value would be a 20% increase over 71. So what is 71 times 1.2? Did you get 85? Okay. So here's the deal. Did you get that? Everyone okay with that so far? So this kind of goes back, we talked a little bit about this with creatinine clearance. And I don't know if you remember, with creatinine clearance, definitely going to be on the final exam as well, there was an issue with body weight. The body weight that you put into the formula, the body weight you use, you wanted it to be a lean body weight without a lot of fat. It's the same thing for the TPN. In a minute here, we're going to calculate how many calories this person should get per day. Let me ask you this. If I stood on a scale the way I look, should you feed every part of me? Is every part of my body metabolic that needs calories? Or is there some part of my body that just sits and hangs there? What don't we want to feed? Fat. We don't want to feed fat cells. So when we look at weight here, what we're trying to calculate or determine, you can see the big dark box says what? Feed weight. We're trying to determine what weight to base the feeding on, and we got to be careful with the amount of fat. We don't want to feed fat. So again, if we're less than ideal body weight, are we thin or are we fat? We're thin. So we could use an actual body weight that's less than ideal so long as it's not a malnourished state. Again, some people who's had GI cancer may not have been eating for a long time, and therefore their weight below ideal body weight's an unhealthy weight. There we would use ideal. If they're between ideal and 120% of ideal, then we could use their actual body weight. That's their normal body weight. But if somebody's fat and more than 20% over their ideal body weight, then we don't want to feed all of that weight. So let me ask you, is his weight below ideal, between 100 and 120%, or above 120%? His actual is above 120%, right? His actual body weight's 95, and we said 120% over ideal would be 85. We don't want to feed 95 kilograms. That's too much fat. So do me a favor, go ahead and calculate his adjusted body weight. I give you that formula there. It's simply the difference between ideal and actual times 25% added to the ideal. So do me a favor, calculate his adjusted, and that's actually going to be the weight that we choose to use as his feed weight because it's the most representative. So it's not going to cut his calories all the way down to ideal, but we're not going to feed a bunch of extra calories based off of the excess fat that he has. So subtract the two, multiply by 0.25, add to ideal, and see what you get. Did you get something like 77? I got 77. So put a big old 77 there in that feed weight, okay? Because as we go forward here, and I may not keep this thing up every time I come back to the worksheet, but every weight we base our subsequent calculations on are now going to be based off of that feed weight. More importantly, do you understand where this comes from? This whole thought process here was to try to find a reasonable weight to base our calculations on because we are talking about how much to feed him. So we want to make sure we're feeding the heart and the organs and the muscle and the bone, but not necessarily the fat. So that's why we came up with that. All of that is kind of summarized on that slide here. So I won't repeat all of that, but that's why we came up with the feed weight of 77 kilograms. All right? Now, looking back on your worksheet, is there some other, and again, above that top line is what we call the pre-step. We now know the way we want to base it on, but we're going to not only include calories, but we're also going to have fluid. So the question is, we need to make sure this person is healthy enough to deal with the amount of fluid we might give them. What is something that might prevent or overload the blood, might prevent the ability to regulate fluid? Kidney function. So all this says is you would also then look at a serum creatinine value, possibly calculate a creatinine clearance using the Cockhoff-Gault formula. Does that look familiar? I hope it looks familiar. We did those calculations. It's on the final exam. I told you that already. So again, make sure you can use that. You would calculate the creatinine clearance. If the person's renally impaired, if the kidneys don't work very well, then you reduce the amount of fluid because they can't handle it. For our patient now, go ahead and say that where it says, is serum creatinine normal? Circle yes. So we don't have any kidney problems. So we won't have to restrict fluid because his kidney function is okay. But would you agree that's an important question to ask before you start somebody on a TPN is to make sure they can handle the amount of fluid you're going to be giving them as an IV. And again, if the renal function is reduced, then you reduce the total volume of fluid. Another one that's kind of important to think about, you probably wouldn't have thought of, is albumin. We've mentioned albumin before. It's a major plasma protein that's circulating in the blood. Your liver makes a bunch of it, and it's a significant component of osmolarity. Have we used that term before? Right? So we talked about osmotic forces and isotonicity, the amount of particles that float around in blood. Well, a significant component of what makes something isoosmotic in the blood is the amount of protein in there, an albumin. And if somebody has had some GI issues, some dietary restriction, then the liver may not be producing as much albumin. They tend to have lower albumin levels, which means when you stick a bunch of fluid in there, if you have less osmotic particles, what happens to the fluid? It leaks out. There's less force to hold it inside the blood because there's not as much osmotic pressure in the blood. It leaks out in places like the lungs and your ankles and your legs and so forth. So that might be a reason to have to fluid restrict somebody. In our patient where it says, is the serum albumin normal? Circle yes. So we don't have to deal with that, but again, it's another important question to ask. I'm going to skip the section about calcium for the sake of time, so let's just drive on from there. So we've got a person with good renal function, normal serum albumin. We've got a feed weight of 77 kilograms. Let's just give this guy what he needs, both in fluid and protein and calories. That's important. I just know when you guys go on your IPPE, if you've not worked in hospitals, the most difficult IV admixture to formulate and make is a TPN because there's just so many ingredients that go in there. So I want to make sure you understand when you think of a TPN, to feed somebody, what do they need in a day? They need the right amount of fluid, they need the right amount of protein, and they need the right amount of calories. Those are the three main targets, goals that you're trying to make in your TPN. All right? So let's all go down to your worksheet. You see where it's on targets? You should be on targets. Number 1, where it says daily fluid needs, TPN volume. All right? The good news is the first target's the easiest thing to do. The total amount of fluid people need is the same, whether you're a girl or a boy, you're old, you're young, doesn't matter. Everyone needs about the same range of fluid each day. So all you need to do for me now is let's go ahead and multiply that range both on the low end by the feed weight, because the low end is 25 milliliters per kilogram per day. So take that times the feed weight of 77 on the low end, and multiply 35 times the 77 kilograms, and that will tell you how many milliliters on the high end. So you're calculating a range. We will choose a number somewhere within that range. And as you're working on that, that makes this an easy one. Everyone, there isn't any clinical variation. There isn't any differences we have to worry about. So when I did those calculations on the low end, I got like 1,925 on the low end, and on the high end, I got 2,695 on the upper end. All right, so let's just choose something within the range. I will tell you now, as a pharmacist, make your life simple. Could I choose something like 2,100, 300, or 132? Yes, you could choose a weird number in the range here, but why make your life more difficult? So let's choose, and so we all choose the same number here. I chose 2,400, 2,400 mLs. Let me ask you this, is it within the range? Because any answer within the range would work. It's in the range, right? Is it a round number, kind of, maybe easy, or are there 24 of something and something? It will make my life easier by choosing a convenient number, but in the end, it was a number within the range, and I thought through and tried to find a convenient number within that range. But in the end, we've just determined for our patient that the total volume of fluid he needs in a 24-hour period would be 2,400 milliliters. So far, so good. That's an important target, but that was an easy one to do. The second one's a little more difficult. It's the protein. It's the amount of protein people need per day, because it turns out right now you guys all need about the same amount. If we were making TPNs for normal healthy people, A, they don't need them, but if we were, then you would all probably need 0.4 grams of protein per kilogram per day. And that's for a normal unstressed person, which I say probably doesn't work for you because some of you ain't normal. I've been there. And secondly, you're a little more stressed than unstressed emotionally. So anyways, either way, that's not who's normally in a hospital. Would you agree? Most of the time somebody's in a hospital, and if they need to be on a TPN, they're not just a normal unstressed individual. And our guy is in there for what reason? Surgery, right? He has a major bowel resection. So he's definitely kind of this hospitalized patient range. Now, a stressed patient is somebody who's had trauma. Think about the burn patient, somebody who's got significant damage that has to be repaired. So the amount of protein you need, remember we talked about, was the amount to replace and repair the amount of tissue damage. So in our guy, let's treat him as a hospitalized patient because he's got some bowel resection going on that he's going to have to heal from. So he needs more than just a normal amount of protein. So calculate the low end and the high end of his protein range. Take 1 times the 77, obviously is going to be 77 grams per day. And again, 1.2 times the 77, I got on the upper end 92. So anywhere from 72 to 92 grams per day of protein is what this guy would need. Okay? Would you agree? It took a little bit of clinical judgment on the protein, certainly more than it did for the fluid. Choose something in the middle. So we're all at the same range, 85. Is 85 kind of in the middle of that range a little bit? So it's just in the middle of that range. It seems like a round, reasonable number. So for the amount of protein I estimated for him on a daily basis would be 85 grams. Okay? Calories. Calories are the most complicated target to calculate because there are 2 steps, all right? That's the only complication to it. There's 2 parts to it. What you're going to calculate first here on the bottom formula is the resting energy expenditure. This is the amount of calories somebody would need if they sat on the couch and did nothing and just breathed, okay, and just lived. If you just sit on the couch and just live, don't do anything else, that's how many calories you would need. That's kind of like me on the weekend on football. But anyway, so if you just sit there and you don't do anything, then you need this minimal amount of calories. It's the resting energy expenditure. It's analogous. Some of you may have heard of the Harris-Benedict equation. But what we're going to use is the Mifflin-St. George equation because it sounds really cool in French. But it's also been estimated to be a slightly more accurate and not overfeed as people. So do me a favor, at the bottom now, after all that blah, 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 use the formula for the correct gender. Use the male formula. Be careful, they're different by gender. And see if you can accurately determine this patient's resting energy expenditure by taking 10 times his weight in kilograms, adding to it 6.25 times his height in centimeters. That's why you needed that height in centimeters. And then don't forget to subtract 5 times his age in years and add 5 for good luck. I don't know why, but add 5. Anyway, so I'll give you a minute here and see if you can, again, this is the point of the calculations. None of these calculations are hard, and in practice, you don't have to memorize formulas, but you can't mess up calculations. You need to be able to use your calculator and accurately use the formula, come up with the right number. And again, you can always verify. My answers are always up on the bottom of the screen there. When you get that answer, looking at your worksheet, you're going to want to put that where it says REE equals, because the value you just did here is the resting energy expenditure. It is the REE, and the value that I calculated was 1,549. Okay, so put that number where it says REE equals and then a blank. That's not your final answer, though. That is not the calculated target. That's the first step. Remember, I said there are 2 steps in this. The last thing I'll just say, just be patient with me. The units for these formulas are kcals, which stands for kilocalories, okay? We will never convert from a calorie to a kilocalorie. It's always in kcals, all right? If I say the word calorie, I mean kilocalorie. Don't worry about switching units. It's always about kcals, whether I say kcal or calorie, all right? So far, so good? Just the resting amount. The last step, as you can see in your worksheet, is to multiply it by an activity factor, because most of us do more than just sit and don't do nothing but breathe. So again, you can see the higher the activity, the more calories you're going to need. You'll see the sicker somebody is, the more their biology is having to recover and recuperate and build tissues and repair and reheal, the more calories it's going to need. So you can see kind of a stair-stepped increase in the activity factor, basing on the severity of the disease. So if you were just confined to bed and not doing much, you would be 1.2. Our guy, while he's confined to bed, he's also healing from a surgery. So let's give him a 1.3 activity factor. So his activity factor would be 1.3, and you can see some higher factors depending on different levels of stress in the body. Since our guy's recovering there, then let's take our 1,549 that we calculated for the REE, multiply it by 1.3 to get a more realistic total amount of calories per day. All right, so if you do that, did you get something like 2,014 kcals? That's the value to put in the big black box. So on your worksheet where it says calculated target for calories, so our total daily energy expenditure, the amount of calories this guy needs to have replaced every day is 2,014. Okay? Does that sound is that a high number? Is that a low number? What is that? Let me ask you this. When you look on the food labeling packages and they talk about percentage from a normal daily diet, do you know how many calories that's based off on a day? 2,000. So we're doing the same thing. We're trying to replace somebody's calories, and an average daily diet is about 2,000 calories. You can see for this person, that's where kind of that number comes from. All right. Now Now we got to go on. So calories is the more complicated. That is the total amount, 2,014. The problem is he's going to be getting some of those calories from the protein. Even though we want them to use the protein to build tissue, some of that protein might get broken down. So the next step on your worksheet down here is to determine essentially the calories from protein. Well, that's pretty straightforward. We know that you get 4 kcal per gram of protein. So let's just take the grams of protein per day. What was our target? What was our target for number 2 on your worksheet? 85. Remember, we calculated and said 85 grams per day is the amount of protein this guy should get. Let's take that grams times the 4 kcal per gram and determine the total number of calories. So from just the protein alone, he'll be getting 340 kcal. All right? Does that make sense? So now what we're calculating is not the total daily expenditure. We know that's 2014. What we need to know is the amount of calories we're going to have to replace. So let's take the total 2014, subtract the amount he will be getting from the protein. So he's going to get 340 from protein. The difference between those two, which is 1,674 kcal, that's the amount we still need to provide him. Would you agree? If he needs 2014 and he's getting 85 grams of protein, then the only amount of calories that he needs to still get is the 1,674. That's an important number. So that's your answer to number 5. And that's an important number that's going to determine how much dextrose and fat. Because remember, those are the two, when we say non-protein calories, the two sources of calories that aren't from protein are from dextrose and are from fat. Okay? And skip that. Don't worry about that. So, though, before we jump down to number 7, we have to do number 6 on your worksheet, and it's an important idea. I warned you kind of last week as well. With dextrose, you can't overwhelm the body's ability to do it. So before we just calculate dextrose, we need to come up with a safety number. And it's the number that says, okay, whatever you think you're going to use, don't use more than this, because this number represents the total amount the liver could handle in a day, okay? And that's just a given value of 7.2 grams of dextrose per day, essentially, per kilogram per day, I should say. That's correct, 7.2 grams per kilogram per day. So let's do that math real quick for you can see on the worksheet number 6. Let's just take his weight, 77 kilograms, times the 7.2 grams per kilogram per day. You multiply that, you get 554 grams per day. But I need to know how many calories. So let's convert the 554 grams of dextrose to the number of calories from that dextrose by multiplying by the fact that it provides 3.4 kcal per gram. So 554 times the 3.4 gives you the fact that this amount here we do not want to exceed. Is that how much we're going to give him? Should we give him the max he could possibly tolerate? No, that's not a good idea either, but we got to be below that amount. So now that we've got our answer for number 6 is 1,884 as our ceiling for dextrose, now we can try to formulate the combination of the dextrose and the fat. Because we know the total needs to be 1,674. Standard formula, right? You guys follow recipes when you cook. A standard recipe for non-protein calories is to give about 70 to 80% of the calories from the dextrose and 20 to 30% from the fat. Standard recipe. Percentages aren't helpful, so let's just use a number. I chose to use 75% dextrose and 25% fat, all right? Let's multiply those percentages by the total, the 1674, to determine how much dextrose I need. So 1674 times 75% or 0.75 is 1256. Take my total, 1674, times 25% or 0.25, and I got 418. So far, so good? That looks good. Should we use them? What's the safety check? Wait a minute here. Double check here. What was our maximum amount of dextrose we could have? 1884. Is our 1256 below that? Yes, so yeah, we could use that. The only other thing I haven't mentioned from fat, and usually it's not a problem, but you always do a safety check for fat to make sure you use never more than 60% fat. If for some reason you had to lower the dextrose down a lot because of kidney or liver function or something else like that, you still can't exceed 60% of calories from fat, or you overwhelm the pancreas's ability to secrete the enzymes needed to handle that. That would be bad. But I would argue those two safety factors are not an issue for us, so we got a good formula. So in your big boxes there, or down below for number 7, we should have our target for dextrose as 1256 kilocalories, and our target for fat to be 418 kilocalories. All right? We got all our targets. Yay! Now we need what? volumes. We need amounts. Remember, we know what we're going to want to get, but we're going to pump these things into a TPN by looking at their volumes, all right? For the sake of time, I'm not going to go into this in too much detail, but I know what I want, I just need to make it. So the question is, which hospital are you working at? Are you working at KU Medical Center, which has a lot of patients doing a lot of surgeries and therefore a lot of TPNs needs, or are you working at a little hospital in rural Kansas that maybe sees an occasional patient who might need a TPN? Point being, if you do a lot of these, then you want to simplify and reduce the amount of time it takes to make them. So in terms of making them, you use an automated pump called an ACD, an automatic compounding device, that you just stick the bags up there and it just pumps it right into the bag for you. You don't have to do a damn thing. You hit some buttons and it go, and it does it. Yay. Quick. But I got 100 of those things to make. Versus the little hospital that's only got one to make, so I'm not going to spend $1 million on a pump to use once a month, okay? So can you still make them without a pump? Absolutely. That's the preset volume method. So when you go through these slides, and I won't get through them all, if you look through there, there is a way to make these TPNs without any fancy equipment. All right, but since most of you at least will be in metropolitan hospitals that probably have some of this equipment, let's work on the pump method, because the pump method is pretty straightforward, and it's kind of the classic way to make a TPN. Because here's the deal. In the pump method, you're going to make one ginormous bag. And if you've ever seen one of the pictures I showed on the first, it's like a 2 to 3 liter bag full of everything that you're going to calculate goes into one bag. So it simplifies things. Calculations are easy. Everything we need, all those targets we just calculated, all end up in how many bags? One bag. Everything we want goes into one bag. That makes it easy. The only trick is, as you'll see here with this method, is you can choose all of these components. And you see on top there, that's the protein. So amino acids are my source for protein, dextrose, and then fat. They come in lots of different concentrations. So the amount I pump will be dependent on the concentration I use. Does that make sense? So all you got to do in the pump method is pick one. You can choose any of those, pick one, and that will determine the volume. So you'll see that here in a minute. And I'll just kind of skip past that. The pumps are these big fancy things. You can tell they have to be done in a clean room. So we haven't talked about it yet, but in lab next year, when you do hospital inpatient stuff, we'll talk about doing it in a laminar airflow, in a clean room, and using all the aseptic technique things to make sure that it's sterile. But these pumps basically just mechanically, you hook up the bags and you hook up the little bottles for even the electrolytes, and it pumps it into this one single big bag, all right? So going forward with my calculations here, we're using one of those fancy pumps in the hood. We're going to choose, we make a choice, 15% amino acid as my source of protein, 70% concentration for my dextrose, and 20% for my fat emulsion, all right? I chose those. I could have used others, but those are the ones that I chose. So now we can base all my calculations on the rest of that, all right? So let's make sure that we're moving on. So on your worksheet, you should be on the second page here. So on the back of that, we're going to start doing macronutrient volumes, all right? So we're about to do the volumes. The only thing before we just rush and do our volumes is this. Let me ask you, how much fluid does this guy need each day? What was his target for total daily fluid needs? 2,400 milliliters, right? What should the volume of the TPN therefore be? 2,400 milliliters. But be careful. Is he getting any other IV fluids? Would you agree that a lot of people in hospitals are on antibiotics? They may be on other medicines given IV. So you've got to stop 1 second to make sure that your TPN volume doesn't have to account for fluid from other IVs. Or what if he was fluid overloaded? What if there was some other sign that maybe it should be a little bit less than the normal amount? My point being is that you do need to think about that volume before you choose to use it. In our patient, he's not on any significant more than a liter of fluid from other sources. He's not got any sort of fluid overloaded to begin with, so therefore it does make sense that this TPN will be his primary source of fluid, so let's make the total volume essentially equal to 2,400 milliliters. All right? So that is what we're going to choose to do that. All right, so number 8 says to determine the protein volume. That's easy. This is where check this calculation. Make sure you can do this. This is simple. You want 85 grams of amino acid coming from a solution that has 15% weight per volume. Could you set up that calculation? I show you my example calculations here. It's easy breezy, I hope, for most of you at this point. You can solve it either way, proportion or using the kind of the dimensional analysis, but essentially 85 grams times 100 mils over 15 grams, grams cancel, gives you a total volume of 567 milliliters. That's your answer to number 8. Do you make sense? Did you see where we couldn't have done the volume until we knew the what? the target. You have to do the targets first, but now that we know we need 85 grams of protein, it's easy enough to calculate the volume once you've decided on the concentration. So once we've done that, easy. So 567 mils provides us the 85 grams of protein that we need, all right? It's pretty much just as easy for the dextrose and the fat emulsion, with the one exception that our targets are in kilocalories. So we have to convert from kilocalories to grams, and then grams to milliliters. So there are two steps. For my example, our target for dextrose was 1,256 kilocalories. You have to divide that first by the fact that there are 3.4 kilocalories per gram of dextrose. So that converts my kilocalories to grams. And then my concentration is 70% weight per volume, which is 70 grams per 100 mils, or 0.7 grams per mil. You divide by that, so the grams cancel, and you get a volume. So I know I'm kind of going fast through these calculations. You can go back and work through them. But it's really just a two-step process. Convert kilocalories to grams, convert grams to milliliters. And you have concentrations and conversion factors for both of those. All right? So doing that, I got 527 mils of the dextrose. Doing the same sort of thing with the fat, my target was different. It was 418 kilocalories. Remember, the conversion for fat's different. It provides 10 kcals per gram, so that number is slightly different. But then divide by its concentration, which we said was 20%, or 0.2, and you get 209. All right? So you should have everything, 8, 9, and 10. Do you have your numbers written down there? We know the volume of the amino acids. We know the volume of the dextrose, and we now know the volume of the fats. You know the volumes to provide the right amount to give you the targets that I've identified. Easy breezy, right? All right, that's half of the calculations, all right? The other half was for the electrolytes. And the only reason this gets a little bit more complicated is there's a lot of them, and I'm not going to belabor this point, but if you look on your worksheet, I've already had filled out the target ranges, because the nice thing is everyone, again, regardless of gender, age, all the other stuff, needs about the same amount of these electrolytes. But there's a range. You can see there's a low end and a high end, okay? But look on the worksheet. This is important. I'll even point this out here. When I scroll down, come on, scroll down to this, and I know my things are going to do here. Let's make sure you look at this part right here. The target amounts are per liter. They are standardized for everyone. The amount everyone needs per liter of fluid. So that's why in these calculations you have to take those and multiply. What was our total volume did we decide to use? 2,400 milliliters, right? That was the total fluid. How many liters is that? 2.4. So you're going to take and multiply each of those numbers by 2.4. All right? So, and again, we don't have time to work on that together, but if you look up here, that's all I did. I want to make sure you understand that's where this 2.4 comes from, is this standard amount over here is per liter. So you've got to make it patient-specific by taking that general per liter, multiplying it by the amount you are going to give for this person, which was 2.4 liters, come up with a new range from low to high, and just choose in the middle. Okay, once again, it's choosing in the middle. The amount that I give on the right-hand column is just a reasonable number. You'll see why I say reasonable here in a minute, but it's within the range. Anything within the range would have been okay. Okay, any questions about that? Pretty straightforward. You have a range, you use that. When I say pretty much okay, there's one thing I warned you about before you got to be very careful with. Of the two electrolytes that you put into TPNs that could cause problems is the combination of calcium with phosphate, because it forms calcium phosphate when you exceed a total concentration of 45 milliequivalents a liter. Would you agree that if you're low on one, you can go a little bit higher on the other, if there are two things are going to mix? So the idea here is the total has to be no more than 45. So again, you can have a little more calcium, but then you have to use a little less phosphate. So again, you're going to add the calcium milliequivalents to the phosphate milliequivalents, and as long as you don't exceed the total of 45 per liter, then you're okay. All right? So the trick here I would tell you here is when we go to do this on this slide, my phosphate that I chose was in millimolars. I had 13 milliequivalents of calcium, but I had 33 millimolar of phosphate. So the only other thing you need to do here, and it's on your worksheet, and this gives you a little bit of background, but you have to multiply by 1.5. So if you multiply for the potassium phosphate by 1.5 millimoles times 1.5, it turns it into milliequivalents. So in this case, I took my 33 millimoles times 1.5 to convert it to the milliequivalents of phosphate, added it to the milliequivalents of calcium, and my total was 62.5. Is that higher than 45? Is that a problem? But wait a minute, I said 45 milliequivalents per what? Per liter, right? Now this total, this 62.5 is the total amount per how much volume am I making? What did we just say? 2.4 liters. So what is 62.5 divided by 2.4? That's the number per liter that I would want to compare to 45. So when you do that, you get 26 per liter, and that's why it's less than 45, which is why you can go ahead and make it. It passes that safety check, right? Last step here, these are all pretty straightforward, and that's what I just want to realize. In the end, you come up with a target amount in milliequivalents. You have to look at the concentrations of the specific products, and again, those are given to you on your worksheet. You can see that here. Given the concentrations, you take the target divided by the concentration, and you convert to a volume. So example, sodium chloride, our target was 72 milliequivalents. It comes in 4 milliequivalents per mil. You divide by that, milliequivalents cancel, and you get 18 milliliters, all right? So, and for the sake of time, I won't go through all of those. I will point out right here, if you're going to go back and look through this, or you can always ask me, potassium is the only troubled child when it comes to the electrolytes because it comes from two sources. The phosphate that we're going to add, we need here, is from potassium phosphate, and the amount you use is the amount of the phosphate. However, is there potassium in potassium phosphate? Yes, so you have to account for that amount. So all I'm showing you here is you're first accounting for that amount of potassium, subtracting it before you use the amount of potassium chloride. So it's a little bit tricky there. All right, so that's where I'm going to just stop.